There is a nucleus known as the substantia nigra, located in our midbrain, the mesencephalon, which is named for its dark coloration, and it contains about 460,000 nerve cells responsible for the production of dopamine. When a person suffers from Parkinson's disease, these cells die without a known. When the affected person notices the first symptoms, approximately half of the cells have already been destroyed. This effect is usually counteracted by pharmacological analogues of dopamine to try to compensate for the loss. But although the patient's condition may be temporarily improved, the fact is that in the long term, his general health may deteriorate considerably. In most cases, depending on the dose and individual neurological disposition of the patient, psychoactive side effects may occur. What is the technique of the permanent needle? On the surface of the ear, there are points that correspond neurologically to areas inside the human body and brain. They are connected to them by nerve communication string. If you know the correspondence between the area of the body on which you want to act and the point of the surface on the ear, you can stimulate it and start a healing process. The scientist Dr. Ulrich Werth, who discovered the effectiveness of this healing process and improved it systematically, implants tiny titanium needles in the area of the ear that corresponds precisely with the substantia nigra. This provides lasting stimulation as titanium needles are incorporated into the tissue of the ear.
The technique of the permanent needle is derived from the auricular therapy and is based on titanium microimplants placed in the ear pavilion that substitute the traditional acupuncture needles. They have the advantage that many more can be placed different to the traditional acupuncture, and in one intervention, especially in chronic and neuro-degenerative, will allow this to be a permanent treatment. The first changes that I noticed when I was treated was when I started walking. I started walking normally and with a better posture. Another positive effect was talking. Right after the treatment, I started articulating better.
Well, as his wife, what I can say is that I noticed an immediate change in many aspects in the 4 years since the treatment. I'm happier and happier because I can see that it's easier for him to do daily activities such as using the computer. After a very little time, the family also started to notice a change in him. He was vocalizing better, and emotionally he was also a lot better. As a daughter of a Parkinson's patient, we noticed an improvement after the doctor's treatment, and we noticed that the stiffness in the right leg and arm that she was suffering from improved. In fact, after 8 years, the improvement has remained and the medication has not increased. Even the doctors and neurologists are impressed on how much she's improved and maintained throughout the years. One example is cooking. She can now cook traditional dishes. She had lost that ability, but now it's been recovered.
Parkinson's disease is a neurodegenerative illness that not only includes physical factors, but also emotional factors. Two of the most important are depression and anxiety. A multidisciplinary team must work to improve the patient's general life quality. The Center for Neuro-regenerative Medicine has a multidisciplinary team that works with the patient to improve their life quality. I discovered the permanent needle accidentally. I worked as a neurologist and acupuncturist, and one time a needle was left under the skin and the effect was phenomenal and the patient was really grateful. After that, I thought about improving this discovery, and some Parkinson's patients came for help. I thought at that time that I would not be able to help them, but I thought we could give it a try. I knew that in this part of the brain, substantia nigra, neurons die. At first, we could not believe that we had a success, but I knew that after stimulating this area in the brain, and I could see that there was an improvement in the life quality and also medication reduction. But there is something else in this real case. A boxer in Germany, Enrico Schulz, a boxing champion that previously to the treatment only had very little natural dopamine, and here, after the treatment, we can see that there was an improvement and an incremental change in natural dopamine only after 9 months, and we can see that he had a recovery to a normal state.